You are watching the Doctalk show.
Welcome back. The month of September is the month where we create awareness about sickle cell disease or sickle cell anemia. In case you don't know what this is a type of disease that affects the red blood cells in your body. The red blood cells contain that element, that pigment, which gives the color red. That's your blood being red, not for other reasons. So for as regards sickle cell, people might be having questions specifically about its transmission, how exactly it's acquired, and who might be at risk of getting sickle cell. Well, our experts in studio are here to tell us more about that. So I guess that goes to you, Dr. Kasiri, being the expert in sickle cell disease. What are there risk factors, things that can, like for example, if let's say you drink this substance, a herbal product, can they get sickle cell? People might have such questions.
Thank you very much.
Who is at risk of getting it?
Thank you very much, Dr. Darius. Like earlier said, sickle cell is really passed on through genes, which we earlier explained, from parents to their children, offsprings.
Could it be like the parents did something that made the genes now bad?
Yeah, no. It's just these genes are passed on from generations to generations.
Okay.
Many times, some of these genes or those building blocks that describe who we are, determine who we are passed on silently, and you may not get to know them apart from some situations. And the situation in which sickle cell manifests as a disease in children is when they acquire one of the gene for sickle cell from the mother and another from the father. In that case, they are born with the two genes for sickle cell.
So children are everyone is always born with the two genes for, let's say, it's the red blood cells in this case?
Yes.
So if so a child can never be born with one gene, in other words.
No.
They're always born with two.
Oh,
No.
yes.
even for the normal, all children actually are a product of the mother and the father.
Yes.
And with regard to that red pigment we talked about, hemoglobin, the makeup of that hemoglobin, part of it comes from the mother and part comes from the
either way, there's
father.
no way you can escape.
There's no way you can escape, and the fact that you are born with either sickle cell disease or no sickle cell disease. So the normal person, scientifically, the normal red pigment is represented by the capital letter A, and so that person would have, a normal person would have two A's, one from the mother, one
genes.
from
Okay.
for the two genes. The child who has, or a person who has sickle cell disease would actually have the two genes being abnormal, and they are represented by the letter S, capital S. So they acquire one from the mother and one from the father.
One S from the mother, one S from the father.
Yes, perfect.
Equals sickle cell.
Equals to sickle cell. If a person acquires one S, which is the abnormal, and then one A, which is normal, that person is called a carrier or trait.
But they're not sick, is it?
Ordinarily, they would not appear as sick, or they would not present with the typical signs of sickle cell disease. Okay. They could be like any one of us here, seated here. And that's why I say that some of these diseases are passed on with silent genes. They only manifest as a disease when they are in duplicate in this individual.
Okay, I think that is pretty much very clear and understood.
And that actually explains that it is not something you can acquire from associating closely or drinking through something or being bewitched. So it is something that you are born with by the fact that your parents had these sickle cell genes, and therefore the child is born with two sickle cell genes,
I think
one
we
from
should
the
also
mother and one from the father.
should also remind people it's also not the parents' fault that they had these genes.
Oh, perfect. No,
it
not.
came from generations in the past, the ancestors. So
perfect.
How the abnormal genes came to be about, no one really knows.
Yeah.
Just the way people are. So we shouldn't stigmatize people and say that no, this one has sickle cell and this one doesn't. Which brings me now to the role of the foundation. Are there specific challenges that the warriors, children who are living with sickle cell, are there challenges that they are facing that you, the organization, are coming to support?
Yeah, of course. I'm not even talking about the family, the sickle cell, the family at large. Yes, the warriors have their, sometimes the warriors' depression is caused by the family. Okay. Sometimes sometimes the family's depression is caused by society. So this is not a small thing. It's a whole big topic of depression because society has its contribution, family has its contribution. But let me focus on the warriors right now. Yes. The warriors, the fact that you grow up knowing that I have sickle cell. First of all, the society sees you as how can I say it? Sees you as a thank you, an outcast. Thank you. They see, they see an outcast. Like but there's some warriors, like the physique really shows that you're actually not normal. The yellowing of the eyes, that's the jaundice. Sometimes they get to, maybe the stomach is swollen, maybe sometimes they're too skinny. So already the society is seeing you as you're not normal. There's something wrong with you. There's always that picture. So you grow up in a society where everybody looks at you as you cannot do anything.
But is that true?
No, it's not true. That's why I'm here to let the public know it's not true. We have warriors that have walked miles, that have flown like they are out there doing work.
Wow, so
so they have challenge because if the society does not believe in them, remember, if society doesn't believe in you, most people do not believe. You feel like everybody doesn't think I can actually do this, so they lay back. And they feel like they need to be given or they need to be taken care of all the time. But then we need to encourage them, let them understand that they're normal people. Yes, this disease is part of them. It's not going away right now. Yes, there's a challenge. It can go away with the bone marrow. But now I'm talking about the fact that that it's not going. It's not going away. It's going to live with me. The society needs to help them learn how to live with the disease. When a warrior comes and says, I can do that, they can wash, they can iron, they can get jobs, they can
be CEOs, they can be teachers,
thank
doctors.
You. So parents, the parents themselves need to let the kids also go to school because they are normal kids. The work. So we as an organization, first of all, like the family itself, like gives up on the child. Okay. Most times when they come to office, maybe because we do sickle cell testing. So this is the journey of when you come, we want to test. Let me see now if family already has a child, and this child is already presenting like symptoms of sickle cell disease, and then we test them. We get to find, okay, now your child has sickle cell. Now that's where the journey begins with us as a family, as a warrior. So we need to help you understand. When we start with because most time these kids are kids. So you let the parents understand the disease so that they can be able to raise the child. You understand? So you start
so that child
helping them.
Still be able to go to school.
To school, you help them how to manage. Please do this, don't do this. Go see doctor. We actually go extra. I think Dr. Kassia has received a lot of patients from our organization. Please go see Dr. Kassia. Is going to help you with the treatment plan. So you help them understand the disease and live normal so that they are able to take care of the child so that they are raised as normal human beings.
Okay.
So
you bring out a very important point. Why they should seek help when they have sickle cell. I think because of the stigma around it, some parents who want to hide the child away. Course. Like in the home, they don't even go to school. They're like, no, this one is sick. Let us stay at home.
Yeah,
so why is it important that families should take their children to the experts, to the doctors?
Give them to the world to understand.
Yes, the warriors. Why should they go to the hospital?
Why are parents supposed to take their kids? This is a chronic disease. You cannot treat it yourself. You need an expert to help you understand the disease. Okay. So if you keep this child that's why there's an issue of dying before the age of 5. They die early. Why? Because parents are hiding them, and this kid is not getting the proper diagnosis or the proper kind of treatment
Or the
to
treatments
help.
they
Yeah,
have to
thank you.
get, yes.
So we encourage them, please, you go see the doctor so that they help you understand the disease and also give you a treatment plan so that this child lives as normal as they can.
And
Yes.
Dr. Kisiri, I think they can, is there any limit to how long they can live?
No, there's no limit. They can grow into very productive adults and
All
we've
the way
seen
up to
many,
old age.
many. Yes, sir.
Okay, so I think you've heard it from the experts. If you have someone who has sickle cell or has just recently been told they have sickle cell, that is not the end of the journey. Please reach out to these experts, reach out to the Uganda Sickle Cell Rescue Foundation, reach out to your doctor, and they can link you up to the experts who manage sickle cell. That is not the end of the journey. These people can grow up to live into full adults, into productive citizens of the country and doing great things in their lives. So you shouldn't lock the child in your home just because they keep falling sick, they keep getting these problems. So I'll talk a bit more about this, how to identify sickle cell disease. But in a nutshell, people with sickle cell, or the warriors, as you call it,
Yes.
Miss Tracy,
Yeah.
the warriors are just like any other person. They can grow up to be wonderful human beings and contribute a lot to our society. So therefore, we should take great care of them and not stigmatize and raise problems. We'll be right back to talk more about the sickle cell, how we can support the children, what exactly we can do, and if there are any tips to prevent, we should also highlight a bit of that.
Okay.
So we'll be right back after the break. Don't go away. If you have any questions, send it to our social media platforms. We'll be happy to respond to each and every one of them. Don't go away. We'll be right back.
You are watching the Doctalk Show.